Hello everyone. I wanted to educate you on the homeless adults vulnerable population ages 18 to 64 and what health concerns that we have for them. First of all, description of this population. Essentially they are those who are homeless. It's kind of, the description is kind of what their title is. They are exposed to the elements. They don't really have safety due to a lack of shelter. They don't have access to basic needs because they're essentially living without resources. They don't have food, they don't have water, and any health concerns that they may have are kind of pushed aside for the sake of survival. So there's actually quite a bit of homelessness in the world. I'll start from locally. In Salt Lake, around 400 people are homeless. Chronically, or sometimes people are only homeless for a certain period of time, such as a couple of days out of the year, or maybe there's a week where someone's homeless. But around 400 people a night are estimated as homeless. In Utah total, it's estimated that 2,800 individuals experience homelessness in a day. 500 of them are chronically homeless, and so what that means is that of the 2,800 individuals, 500 of them, at least 500 of them, are homeless every single night and have been long-term homeless. In the United States, around 553,700 people are homeless. And then with COVID, a lot of resources say that with COVID, those numbers are greater, but it's hard to get an estimate based off of restrictions for social distancing, and it's just hard to get those exact numbers. And internationally, around 2% of people, or around 15 million people, are homeless. So Utah, in general, has a lower national average. I believe that it was mentioned that 10,000 or 10 out of 10,000 people are homeless in Utah, as opposed to 17 out of 10,000 people being homeless in the United States. But because Utah is located in the desert, and because the summers are so hot and the winters are so cold, homelessness in Utah can be quite severe. So some contributing factors to the homeless population for the social determinants of health is that healthcare access and quality is, well, next to none. They have emergency services, but they don't really have insurance. They don't have a way to access medications on a regular basis, and they don't have a way to pay for what they need. And so any issues that they might have medically aren't usually addressed, at least not adequately. They do not have economic stability. I read that it takes about, for a person in the United States to afford an apartment that will suffice, that is safe, it's about $16 an hour that they need for 40 hours a week. And minimum wage is an average of $7. And so in order for them to get out of their economic rut, for lack of a better word, they don't just need to find a job. They need to find a job that is above minimum wage. And so they need to go from off the streets to a job that is at least double what minimum wage is, which is extremely difficult to do. And it's even harder on those who have families. In a neighborhood and built environment is another social determinant of health, because they don't really have a stable home. They don't have access to one place where they can be safe, so they're exposed to elements and violence, and they don't have that housing that is essentially needed. So some specific concerns and contributing factors: because of the lack of health care, as mentioned before, other than emergency services, the homeless population doesn't get any of their injuries or sicknesses or any abuses of, whether it be substance or, street abuse or mental health issues. None of those are addressed. And so a lot of times they have to find a way to cope with those things. And it's just a vicious circle. So someone who has mental health issues won't get the counseling they need, so they turn to substance abuse, or it's just kind of a vicious catch-22. Those who are homeless are, like mentioned before, not usually able to find a job that can support them and get them off the streets. And so, again, it's hard for them to find a job that will allow them to get off the streets, and not just any job, but a job that will allow them to pay for an apartment and food and medical care. It's just such a great jump for them to get to that. And then those who are homeless aren't able to find a place to live that was meant for human habitation. And what that means is, when you are viewing any city in any part of the world, there are obviously abandoned shelters and, places that a person could sleep, but it was not designed for a person. And so being in those situations where there's not safety codes or fire codes or insulation or heating or air conditioning or security measures, that puts them in extremely dangerous situations, which will be addressed further in the presentation. So some root causes. The root causes of all of this comes down to basic needs, which is not able to access health care, so that they are not in the state of mind or in the physical, state to get a job to get them off the streets. So those who have chronic ailments or who have injuries or whatnot are not able to find, essentially resources to get them to the point where they can look for a job. And that's a big root cause that contributes to homelessness. So for the Maslow's hierarchy of needs, met needs is basically anything that would be from charity. Living on the streets basically means that none of your needs are met unless they are given to you by someone else. Unfortunately, those who are homeless are essentially in an infantile position where any needs that they need to have met have to be given to them by someone else, just like a child would need. And so they can't just go out and get a home. They can't just go out and get safety or, psychological, needs met. They can't just get self-actualization. They need help. And so unmet needs would be basically every category. Psychological issues and safety and self-esteem would be the main ones that would take a hit in a situation of homelessness. None can really be met in the beginning. So the self-actualization and those really can't be met until at least safety and psychological issues are met. And obviously when you're on the streets, you're extremely vulnerable. So functional level for those who are homeless is very, very limited unless there is an opportunity presented to them or charity is offered to them. They really can't function because they just don't have the resources to do so. Basically, they're just trying to survive. And so their main point and purpose is to survive, and there's not really a way to function as a normal human society in that situation. And then likely health outcomes because of their poor diet, lack of health care, and exposure to the elements. In addition, unaddressed mental health and substance abuse issues leads to poor outcomes and earlier death among the homeless population. So specific concerns, for instance, communicable diseases or infections. The homeless population reportedly has higher instances of tuberculosis, HIV, and hepatitis C, but as we've seen with the pandemic COVID, any transmittable disease that has a higher prevalence, or any transmittable disease has a higher prevalence of spreading throughout the homeless population because there are no walls, there are no, you can maybe socially distance, but because of the desperation of their situation, they may not have the option to do so. They may be stuck in crowded shelters or under a bridge where it's crowded, and so disease spreads. And then later on, we'll mention some of the more violent issues such as, sexual assault. Things like STDs spread too because there's not really access to protection or safety to prevent something like a physical assault to a person. So that's one of the other issues with communicable diseases is STDs as well. So hospital emergency rooms can offer temporary medical help to those who are weak, but they may not be able to get to that, or they may not have, they may have done it a million times, gone to the emergency room and not been able to get the help that they need. Or they may need a more in-depth amount of help. So in order to prevent the communicable diseases that are mentioned, there would need to be charity to them. There would need to be access to medications, vaccinations, and supplies that allow them to participate in personal hygiene and have a regular, maintenance of their body. So just basic needs that aren't being met. So non-communicable diseases, any ailment that a person has that requires regular medical checkups, such as type 2 diabetes or heart failure, that is just exacerbated by the situation. They don't have access to the regular physicians, and so any ailment that they do have that maybe could have been treated in an office with a simple medication, they don't usually have that. And so it's just it's a catalyst for an even bigger issue or an even bigger health issue. So what they would really need is access to screenings for disease. So someone who has a history of heart disease would need to be able to see a doctor on a regular basis to get labs, imaging, access to support systems. Healthy dietary interventions is a big one. Someone with type 2 diabetes who does not have access to healthy food will likely have issues with their blood sugar, and those who have type 1 diabetes will have the same thing. And like as previously mentioned, medications to support these chronic illnesses are desperately needed. So for self-care and self-harm, I mean, the situation of being homeless is extremely stressful, and so mental illness is greater in homeless populations than in those of the general population. Those who are homeless generally don't get enough sleep because they're so unsafe. They probably either are too nervous to sleep or don't have comfortable places to sleep, and so this contributes to existing health and ailments and mental illnesses. Any person who's not getting enough sleep, all of their problems are greatly exacerbated. And then suicide is also a greater risk for those who are homeless, as well as violence and substance abuse. You know, people who are on the street are in desperate situations, and so in order to take care of themselves, they may resort to violence towards other people. And those who are truly in a desperate situation and don't see a way out may resort to something like suicide. Outreach programs are really the only way to help them because they don't have the resources on their own to help themselves. And so access to counselors, support systems, and medical assistance needs to be offered. And again, basic needs such as hygiene and food and sleep need to be met. So specific concerns: risk for harm by others or to others. Violence is extremely prevalent in the homeless population. Women, younger individuals, and weaker individuals are most at risk. This includes the gay and lesbian population. This includes the transgender population. Anyone who's vulnerable is likely to be a target because of their weakened state. Violence can be socially approved as a means of survival, and so if you're out on the streets and you have to get food and someone has it, then it's perfectly acceptable to put their life at risk in order to get whatever advantage you need, including their food or whatever resources they have. Sexual violence, unfortunately, is a big issue in women and other vulnerable populations face that. I'm not specifically addressing youth. I'm more addressing those who are in the, I think it's between 18 to 64 years of age. And so younger youths have also been mentioned, but women they mainly have to deal with sexual violence. And so some women will enter into willing sexual relationships to gain protection on the streets. And in order to mitigate harm, essentially safe environments need to be accessible to them. There needs to be a place for them to be safe and to feel safe. Once they have access to those safe situations, then they're a lot less likely to be put in those violent situations. These are my references. Thank you so much for your time.